A senior scholar for Johns Hopkins Center for Health Security. Thank you so much, doctor, for joining us. What was so concerning about these vaccine changes?
That they were dangerous, that they occurred devoid of any kind of semblance of rationale, that this was something that was basically pursued because RFK Jr. has this animosity towards vaccines, to science, to the scientific method, and he was going to go to Washington to go wild on health, and that's what happened. And the fact was that these changes are putting children's lives in danger, are disrupting the entire vaccine ecosystem, and they occurred basically haphazardly, unpredictably, and they've done a lot of damage.
Can you talk about, in your opinion, what the argument was for these changes?
There was no actual valid argument. It was all based on RFK Jr.'s twisted logic, which stems from decades as an anti-vaccine advocate. So basically, they've doubted the safety of these vaccines. They have spread disinformation about the safety of these vaccines. They have pandered to anti-vaccine groups, and they basically tried to codify that in the laws and regulations in the United States when RFK Jr. ascended to becoming the most powerful health official in the United States.
We know that the judge suspended the appointments of the 13 new members of the CDC's Vaccine Advisory Committee. How do you hope to see the committee change moving forward?
What's happened already is hard to reverse. Even though this judge has made the right decision and come to the right conclusion, the whole vaccine ecosystem, as I said, is completely disrupted. And people don't trust the CDC now because it's under the thumb of RFK Jr. So I don't know how they can repair the ACIP because they have just put out so much disinformation, even if it was an illegitimate ACIP. But what you want to do is have people that actually are experts in infectious disease, experts in vaccinology, experts in pediatrics, experts in biostatistics. But those aren't people that RFK Jr. is going to recognize. You have to really be, swear fealty to RFK Jr. and his irrationalism to actually be on any of these committees. So I don't know how this gets turned around. And right now, the professional societies like the American Academy of Pediatrics, the Infectious Disease Society of America, have stepped in to fill this void because of the damage RFK Jr. has done to our federal health agencies.
What do you advise for people who are listening right now with regard to getting these vaccines?
I would advise them to talk to their primary care physician and also look at the resources for the general public that the American Academy of Pediatrics, the American Academy of Family Medicine, the Infectious Disease Society of America, and other professional societies of physicians have put out. There's also good guidance from state health departments, with the exception of Florida, of course, but state health departments also are good sources of information.
Dr. Adalja, we thank you so much for your insight. Appreciate it.
Thanks for having me.
Overseas tonight.